This case is about a 14-year-old castrated male West Island Terrier presented for a couple of days of vomiting, diarrhea, and shaking. The ultrasonographic evaluation we will discuss is centered on the liver. Initially, the probe is placed just caudal to the xiphoid process and in a transverse position. As we evaluate the liver, we can see that it is moderately enlarged and diffusely coarse in ecotexture. As my hand is sliding along the left lateral liver lobe, we can observe this large, primarily hyperechoic mass deforming its contour. Part of the mass is poorly echogenic. Using color flow Doppler, we can then compare the vascularization of the spleen with the vascularization of the mass. Moving towards the right side of the dog, we encounter in the near field some echogenic material, and then we can see a very distended gallbladder surrounded by hyperechoic fat. Echogenic material, some of it shadowing, is seen in the lumen, and we also observe this distinctive striated pattern along the periphery. We move towards the right side of the liver, and in the near field we still observe some of this poorly echogenic material. We are trying to evaluate all the contour of the gallbladder, and now moving towards the left side of the gallbladder, we move the probe 90 degrees on a longitudinal scan and assess similarly the liver, the large liver mass seen on the left side, as well as the gallbladder, which remain in a rounded shape despite having switched its axis to longitudinal. Now we are going to try to evaluate a little more of the right lateral side of the liver, but encounter interference with bowel segment, and then we can see part of the liver and a discrete rounded hyperechoic nodule is actually not it. Based on this finding, the dog was sent to surgery. At the opening of the abdomen, a moderate amount of black jelly-like substance was found and represented part of the gallbladder content extruded from a tear noted near the cystic duct. A cholecystectomy was then performed. Thereafter, the left lateral liver mass was then exteriorized and removed. The histopathological diagnosis of the left lateral liver mass was a well-differentiated hepatocellular carcinoma. The biopsy of the rest of the liver revealed neutrophilic cholangitis with peribiliary fibrosis. The gallbladder mucocele was confirmed to have ruptured, and there was evidence of diffuse transmural necrosis. In addition, fibrinosuppurative peritonitis was diagnosed on the hepatic and biliary sample submitted.